Hello, hi everyone. Welcome to today's Global Mental Health Peer Network Speak Out podcast. My name is Grace Nyambura. I am a psychologist and the Regional Chairlady for the Northern African region of the Global Mental Health Peer Network. Today, I am joined by other Global Mental Health Peer Networks that members. That is Jennifer from Nigeria, who I will give a chance to introduce herself. Jennifer, please go ahead and say something. Please introduce yourself shortly.
Thank you, Grace. Yes, my name is Jennifer, and I work in primarily as a media and communication personnel, and I have a lived mental health experience. And GMHPN has helped me walk through the process, and so I am glad to be sharing my knowledge and the experiences I've had here on the Speak Out podcast today. Thank you.
Thank you, Jennifer. The next member is Constance Mabia, who is from Kenya. Constance, please go ahead and introduce yourself.
Hi everyone, my name is Constance Mabia. I am a psychologist from Kenya and an empowered person with lived experience, and I am so excited for today's session, and I can't wait to learn from each and every one of you.
Thank you, Constance, and welcome to the session today. The next person is Natasha. Natasha, please go ahead and introduce yourself.
Hello, everyone. I hope we are all doing well. My name is Natasha Njafuh. I'm a Cameroonian. I'm a mental health lived experience expert, and I lost my dad at a very tender age, and so I lived with trauma and was battling with depression. And funny enough, I really didn't even know what I was going through. So this staying in the dark for that long helped me to understand and even gave me a passion for mental health. I've been with GMHPN for 1 year, and I'm so glad I've been part of this team because I've learned a lot. I've learned peer support, and I'm grateful for this podcast, and I'm excited for how things will roll out because I believe this is the beginning of a totally new journey, and I'm excited about it. Thank you.
Thank you so much, Natasha, for sharing with us. And we are pleased to have you here. We are pleased to have the panel, which is a panel which has vast experience in terms of mental health and lived experience. And today's discussion, we will be discussing youth mental health and substance use in Northern Africa. I think over time, as young people navigate complex social, economic, political, and other landscapes of life, a lot of young people have been facing silent battles with mental health struggles. And of course, this has contributed to a rising cases of substance use. And so in this session, we are aiming to unpack the challenges and then highlight the cultural and systemic barriers to care for persons who are battling or living with substance use disorders or even just substance use and misuse uh, disorders. Yeah. And then we will explore practical community-based solutions which will support and protect the well-being of the young people in the Northern African region. So we will just jump right into it. And I will start with our first question to the first speaker, Jennifer. So youth mental health issues are often hidden behind silence. What factors, that is culturally, familiar, institution, or any other related factor, do you think most contribute to this silence in Northern African communities? Jennifer, please go ahead.
Thank you so much, Grace, for that question. And like you listed in the question, the cultural, familial, and institutional barriers or factors that are prevalent. For me, I think one of the biggest ones is culture. So you have the African region is very communal, and so because of that sense of, oh, we are one, we're together, you will think that that will help promote a culture of speaking out. But reverse happens to be the case here, where uh, you it families don't want someone within a member of theirs to be looked at as different from the rest of the community. People don't want to parents or siblings don't want to feel like, oh, ostracized somewhat, when uh, any of their family members seems to be suffering from any mental health issues. And so that cultural stigma, that uh, yeah, and then I'll also say this, that still as a subset of cultural stigma is awareness. A lot of again, most African communities are very familiar with medicinal herbs, things that relax, that just things, beneficial medicines, but that come from nature. And so most times people have not known how to deal with mental health issues. So anything that they cannot mix a herb or boil something or tell you to wear something and then it'll go, seems, you know, it just seems like, oh, it's not there. We cannot see it. And so that cultural norm especially has made, it has sponsored um an exacerbation of mental health issues among young people. Hi, Grace.
Thank you so much for sharing, Jennifer. I think you've brought out some of the key issues that really affect the Northern African region when it comes to substance use, and that propagate the silence and the suffering in silence, especially for young people. Stigma, of course, and cultural barriers, um, which then would lead me to the next question, which will be directed to Constance. Constance, what do you think, what role do you think religion plays and spirituality plays in how young people in Northern Africa understand, or rather hide or heal from mental distress and addiction?
Thank you so much for this question, Grace. I'm going to quote a remarkable person that we were taught in school, Karl Marx. He said, religion is the opium of the masses. And I think in Africa we have seen how religion has been used to drive so many things. And I think mental health has been one of these factors. So I'm going to center on three things on how religion has played a big role on how young people understand or hide or heal from mental distress. And the first one is on meaning making and coping. Religion and spirituality help youth interpret distress through a lens of divine purpose, fate, or testing, offering comfort and resilience during hardship. So we have seen instances where mental illnesses have been referred to as suffering, and many Africans believe that suffering is a test of faith, right? So if they believe that suffering is a test of faith, that means that when you're having a mental illness, or you're going through a difficult time mentally, you're told that you'd have to pray. So prayer is sort of an answer to all sorts of mental illnesses, and people would not feel comfortable because they think that when you're having a challenge, I'd say an example of depression because that's my lived experience. When you're going through a depressive episode, you are taught to believe that this is supposed to last for a specific time because you're just suffering, either because of something that you did, so it's punishment from the higher power. So you'd find so much shame in telling people that you're going through some sort of illness or a mental illness because you know that people are going to think that you did something wrong, and so you're being punished either by the higher power or whoever you believe in. So it creates a lot of stigma and people do not feel comfortable in sharing. The second is on trusted support systems. And this is where religious leaders and institutions are often more accessible than mental health professionals. And so they are made the key sources of informal counseling and community healing, especially when they are sensitized to mental health issues. So we have seen that, especially here in Africa, I'd draw this now to my country here in Kenya. When you're having a mental illness, the first point of contact will always be a religious leader. And it's because they are seen to be people having a lot of knowledge. When the fact the fact is that they do not have training on mental health, or they do not have basic training, including mental health first aid. So when people go to these religious leaders, sorry, you are told and you are made to believe that this illness, first of all, it's seen as a westernized concept. So you're going to be told that these are things that as Africans we do not go through. So you're made to believe you're not also supposed to experience any mental illness or any mental disorder. Thirdly, mental illnesses and addiction are often viewed as moral or spiritual failings, leading young people to hide symptoms to avoid shame or judgment from family and religious communities. So I think this is where I have emphasized on, if you're going through a difficult time. I think some time back, my friend, she is a lived experience. She's a person with lived experience as well. When she shared with her family what she was going through before she was diagnosed with schizophrenia, she said that her family took her to some religious leaders and they had to keep praying over her. And when they saw that the situation was not getting better, they ruled out, or they said that she's possessed by evil spirits. So this shows how religious leaders are people who are, they are seen as important figures in the society, and what they say goes. So if they make people believe, or they tell people that mental illnesses is a taboo, or is a punishment, or is is something that is demonic, people are not going to be comfortable sharing what they're going through, because you're going to be viewed as a person who has failed. You're going to be viewed as a person who is an outcast. So these are the factors on how religion has been preventing young people from seeking help. And I would really like to emphasize on that point, whereby you think that this is just a phase, whereby if you're having, like, just like I said, if you're having a depressive episode, you do believe this is a phase. So you know that with time it's going to pass. So you're not going to tell anyone, and probably it's getting worse. So you won't tell anyone, and you're not going to seek treatment. You won't seek treatment because it's not accessible, and you won't seek treatment because when you went to a religious leader, they told you that you have to pray it and you have to get over it, because these are not things that Africans go through, and it is more westernized. They normally use this concept of our ancestors and our grandparents and our great grandparents did not go through these challenging times in reference to mental illnesses. So, you're also not supposed to be going through them. Thank you.
Thank you so much for sharing, Constance. You brought some very interesting factors that really propagate uh, mental illness, or rather propagate substance use and addiction, because one of the realizations that you will come across is substance use and addiction. Most of the people who are deep into it, it's usually because they don't have, or they don't feel like they have a safe space to let out their emotions. So the substance use is usually a way to just let out their emotions, or rather cope with the situations that they're having. And really, I think in Africa, religion, especially in just the general Africa, we've seen that religion has really been a barrier towards access of care to persons who are struggling with substance use, because of the things, or rather the stigma of maybe your caste, it's a family thing. They point out that family, this family is usually like this. It's something you did. You're just immoral. It's decisions you're making. Well, really, this person just needs some sort of support. Thank you for raising that. And I think that's something we really need to think about as a continent, and also as a lived experience advocates, or rather mental health advocates. How then do we shape the future of mental health for other people also who are struggling within the African continent? But before we do that, allow me to speak to Natasha. Natasha, have you ever felt like the system, whether that's healthcare system, the schools, or rather the law enforcement system, criminalized your struggle instead of supporting it? And if so, what happened, and what would real support look like for you in that moment when you were going through it? Over to you, Natasha.
Okay, thank you so much for the question. Well, I have definitely felt like I was failed, like the system failed me. I would start with the schools. I honestly feel like in fact in Cameroon here, there's a lot of stigma concerning mental health, and I totally agree with everything Constance said, because Cameroon is also one of those countries that is highly spiritual. And in schools, well, people don't see, or principals or the administration of schools, they don't really see the importance of having counselors or youth mental health experts that can help the children at school. Because I personally believe that most of the the attitudes that students have in school comes from the house, it comes from the home. And when parents of students that don't know or are unaware of things like mental health and its existence, it stigmatizes the children. It makes the children feel like their parents don't trust them. It makes the children feel like they are hallucinating or thinking off. So when they get to school, they either have poor academic performances, or they join bad companies and stuff like that. And then we have things that happen in the society now, like juvenile delinquencies, simply because the schools don't find it important to have counselors on campus. And for me, that's something that I would have needed at my level, not necessarily because I was a delinquent student, but because to some point I needed care. I needed people who were going to watch out for me, look out for me. Now, I'll go to healthcare. Healthcare, concerning healthcare, in Cameroon, we don't have, well, there are NGOs that are coming up now, but we don't have clinics for mental health patients. We don't have clinics for mental health patients. And it makes it in such a way that sometimes when you go, if you go to the hospital because you have a mental health issue, say depression or anxiety, they will not take your case seriously. They will look at you like a nuisance and a misfit for the society. So they don't really take care, they don't really pay attention that, oh, this is a serious case, we need to attend to this person, we need to attend to that. They don't see it that way. So concerning healthcare, that's another system that has really failed. It has really, really failed. And then I'll go to the law enforcement. Sometimes the police, when they see, should I say, young boys or young people that are probably from poor backgrounds, or people that have mental health issues, they see them as a nuisance or criminals even, that are harmful to the society, because they feel like they are going to rob, they are going to cause some kind of nuisance to people. So they are just rejected. They don't even see. In fact, whenever they see those kind of on the street, they are quick to criminalize them, or to torture them, or to beat them up and stuff like that. Now, I'll talk about um what happened. Okay, I've spoken about what happened. What do real support look like? Honestly, for me, real support will mean that mental health clinics that there should be mental health clinics. There should be an existence of mental health clinics, because even though there is still stigma, there is a very few population that is beginning to believe that mental health is real. Just like Constance said, many people, especially in the religious community, feels like these mental health issues are hallucinations, or they are westernized problems that youths or people that are complaining or they are claiming to have mental health issues have accustomed from the westernized world. So I would suggest, or real support for me will mean that there should be mental health clinics in our communities, free or low cost therapy service, trained school counselors, and youth centers where it is just like a safe space where children or youth are not, they don't feel scared of being judged, because they know that they will be listened to. Because sometimes youth don't even need you to tell them what to do. They just need to empty out their hearts. They just need to pour out their hearts, and they need someone that will listen to them. So for me, that's what it will mean. And it will mean changing how we view suffering in Cameroon or in Africa, from seeing it as a weakness or danger to recognizing it as a human experience that deserves compassion and care. So I honestly think that there is need also for awareness, because as I said before when I was introducing myself, I did not know that I was going through trauma. I did not know that I was going through depression. So if there's an awareness, if we have more awareness campaigns, people that are going and having outreaches concerning mental health and its existence, I think with that many people will get to understand that this issue is a real thing. It's not just hallucinations, it's not just things that people make up in their heads. So, and it's now like this, it's very rampant among the youth of among Cameroonian youth. So you see youths that are depressed, you see youths that are almost going off, like they have mental disorders, psychosis, and parents just feel like they have to take their children to pastors or religious leaders to pray for them. Whereas people or these youths just need attention, they just need care, they just need someone that will speak to them, listen to them, just be with them. Sometimes it's not even speaking or advising. They just need someone that will be present. Let them know that they are not alone.
Thank you so much for sharing with us, Natasha. That is such a heavy story you shared with us, and which happens to be the reality for many African young persons, or rather young people, who are
Yeah,
struggling or battling with substance use, especially because they can't come out and say that this is a struggle for me, because judgment begins right from home.
yeah,
And so they lack a sense of belonging, or rather they don't feel like they feel worthy, they feel unworthy, sorry, they feel judged, they feel ashamed, they feel,
yeah.
the systems are just working against them. So thank you for sharing, and we really appreciate you sharing with us your story. And now I'll go back to Jennifer. Jennifer, so recent WHO data has suggested that over 30% of young people in the Northern African region, Middle East rather, and Northern African region experience mental health issues. Yet fewer 10% receive formal care. Yeah. And I think from what Natasha has shared, you can see how structural barriers have led to her maybe not getting the support that she needed. And this is the story of many other young people. So in your experience, what are the biggest barriers to accessing support, and how have you personally navigated or maybe struggled with them? Over to you, Jennifer.
Yes, Grace. Natasha has really, spotlighted the issue of accessibility. And you even when you diagnose, or maybe not diagnose, but you realize that, oh, something is wrong. That was my experience. I didn't know what it was, but I knew that, wait, something is wrong. I needed to speak to someone about what it was that I was going through. And then you start asking yourself, okay, where do you go to? Who do you speak with, in terms of a professional? And by the time you find a professional or a facility that you can access care, then you have to jump through the hoop of finance. What does it cost? And in the context of Nigeria, where I stay, the health insurance system is still coming up. Is not as standardized in comparison to other countries, and so most people have to pay for healthcare out of pocket. Now, when you have to pay for healthcare out of pocket, it means you're going to be paying a lot more than you would have paid if you had an insurance. And so all funding and accessibility are like one of the huge or the biggest barriers to accessing care. And for me, you asked, how I navigated it personally. And honestly, I have been blessed with a great support system. And so, when I found out that something was wrong and I didn't know what it was, at the time, the person I was working with is a very forward thinking person, and I spoke to my boss and said, oh, this is what these are the thoughts that go through my head, suicidal thoughts and things like that, and I don't know if it's normal, and I'm not able to function. And I just explained. By the time I did after I explained, she referred me to someone, to a psychiatrist. She said, okay, I should call this person and speak with the person. I did, spoke with the person to find out the cost, for me to start therapy and things like that. But by the time I heard what the cost was and I couldn't afford it at the time, I just stepped back. And then that now gave room for months of suffering and dealing with this thing by myself, until I got to the point where I couldn't anymore. But the good thing was, between the first, my speaking with the first professional, I started putting money aside, and, being able to access treatment again. I was referred to a different facility now that was owned by the government. And so the cost there was subsidized. I started accessing care, therapy, and, I was placed on medication and all of that. But in between, from that time, I've had a lot of support, from my loved ones and people who care about me. One of my very good friends, who is a medical doctor, every time, for a couple of months, or sometimes she'll just check in and say, hey, do you have meds? Are your meds finished? I'm like, oh, this is what's left, this was left. She's like, okay, she's doing a medicine. She's refilling her own personal drug. And she was like, she just thought to ask. And I'll send my prescription to her, and then she will help me fill it up, until, sometime over a year ago, I now had an opportunity to get health insurance. And so the health insurance has helped greatly, has covered a lot of things. The only thing, my health insurance, so I was hospitalized a few times, and it was based off of my, my mental health. And then you find insurance, the health insurance say, companies say, oh, they do not cover for mental health, uh, in as an inpatient within a hospital, a clinic, or a facility. So they will cover for your medication and maybe therapy or seeing the doctors, but the money or the payment for boarding or being kept as an inpatient in the hospital, they won't cover that. And so at least that was my own experience. And to be honest, the way I have had to navigate it is really just depending on my support systems. And not everybody will have support systems, and I understand that. And if you're still able to work, or to earn some money for yourself, even with whatever whatever lived experience, or no, whatever condition you're treating, whatever mental health condition you're treating, if you're still able to work, it will go a long way, because also being able to earn money and save or put aside towards your treatment. So that's how I have been able to navigate the access to care. But I recognize that my experience is not the standard. Very many people still are not able to access the care. And for me also, stigma is a barrier. I think it was either, I'm not sure if it was Natasha now, or um yeah, I think either Natasha or Constance. I think one of them was speaking about how stigma also comes in the way of accessing, care and treatment. And so even for me, in my personal experience, I had to navigate that stigma. I had to come to a place where I said my well-being was more important than what any other person you know, cared or thought about me. I had to put my own well being first. And I started the journey by myself, without the support, without. So even the support that I'm talking about met me on that journey, met me halfway. But if I never took my well-being serious enough to damn whatever stigma and whatever consequence, and just move forward, then the support that I now enjoy will never have come to me. So we also, as people who go through this experience, whether as peer workers, stakeholders within the mental health, system at any time, have to advocate for people suffering from mental health conditions to be the first, to be your first savior if you can. I know that the conditions vary, and there are times, your there your so should I say, your mind is altered to a sense that you're not even really able to do much for yourself. But as much as is within your power, as be your first savior. Help will come eventually, but you will not be able to recognize it or to see it coming until you take those first steps. And part of the first steps could be painful, because my employer at the time when I started treatment, my body still was trying to adjust to the medication and things like that. And so my work suffered to an extent that I was open to my employer to say, oh, this is what I'm going through, this is what I'm treating, I would like some form of leniency this period. But my work was terminated, after about a month or two. And the excuse from my employer was, now, not the first employer, not the employer who referred me to the first psychiatrist. This was a different employer. And my employer at the time said, oh, I'm just giving you time to take care of yourself, to rest. But somebody having to treat a mental condition and being relieved of their job, it doesn't help. But that was a rough patch, and I was like, yes, I will deal with the consequence of being open about it, and finding treatment or getting treatment for myself. And eventually, a lot of people are, people who care about me are beginning to understand. Until now, not everybody still understands, but I mean, I'm not able to change everybody's mind, which is also why we're having this conversation, that everyone just gets to pitch in and do the most that you can per time. Thank you.
Thank you so much for sharing, Jennifer. I think you've brought out some really important and key aspects when it comes to mental health and psychosocial support. Issues of affordability, availability, accessibility, and even acceptability, but also the quality of care that persons who are struggling with their mental health are able to access. We, as a as a continent, we really are struggling with, with all this, with the affordability, availability, accessibility, acceptability, and quality of care, especially at primary level. And thank you for sharing. And I know that the story you've shared is most likely similar to many other African young persons who are living within Africa. And we hope that over time we are able to create changes, these systemic changes that will eliminate the barriers towards dignified care for persons struggling with substance use and other mental illnesses. So allow me now to go to Constance. Constance, in some Northern African countries, youth unemployment exceeds 25%. How do you see economic instability affecting the mental health and risk behaviors like substance use of young people? Over to you, Constance.
Thank you so much, Chris. I think Jennifer highlighted some brilliant points that I'm also going to touch on. How economic instability will be affecting the mental health of young people and risk them to behaviors like substance use. So the first one should be on psychological distress and hopelessness. Long-term unemployment and economic hardship fuel feelings of despair, anxiety, and low self-worth, and this would increase vulnerability to mental health issues. The society has put up a standard. When you have completed university, you are expected immediately to get a job, a high-paying job. I think I can say like in countries like here in Kenya, you are viewed as a person who has already made it when you work in cities like Nairobi. And little do they know that even working in capital cities, it's even more draining because the economic the economy is not even as stable as it should be. Recently, I was co-authoring a paper that was talking about challenges faced by African youth. And I think one thing that I really wanted to bring out was the factor of unemployment and how it has really made people to have a sense of low self-esteem and low self-worth. And I think we have seen this in particular because here in Kenya, we do not even have accessibility to good jobs. So you find amazing university graduates even settling for jobs that are not even paying them as they should be. Or you see that even with entry jobs, you are paid close to nothing and it's not able even to cater for your daily expenses. And we have seen how this has worsened the cases of anxiety and depression. Let's not talk about the sense of comparison, whereby it is emotionally taxing when you're a young person and you're always comparing yourself to someone who's probably employed and you know that they are they seem to appear to be having some sort of stability in their lives that you do not have. So this comparison is what is always going to make you feel like you're inferior to other people. So when you feel inferior, you do not have a job, you do not have a source of income, it is easier for you to get prone to substance abuse. So when you're having this sense of worthlessness and hopelessness, you're going to develop poor coping mechanisms. So without access to formal mental health care or stable income, some youth are prone to turn to alcohol or drugs as a means of escape or stress relief. And I think as a young person, I have seen how the trends of using alcohol or drugs has been so normalized to the point that if you tell someone you do not use alcohol or drugs, you seem to be abnormal. And this is because we have become a generation of young people who we are prone to not talking about our feelings, but we tend to adopt riskier coping mechanisms because they provide some sort of temporary relief. But that is what I can say the society has pushed us to. There aren't enough good jobs, and even if they're emotionally taxing or you're expected because you're just out of school, you have to push yourself so much and you're not even getting well compensated for it. And we have seen that this is more likely to drag you to depression or to anxiety, and leave alone when you explain it to someone who is much older, they are not going to understand. That's why we even see many young people or many people stay in extremely toxic jobs because they know that nobody will understand, or because you're taught to believe that that is your only option. Thirdly, there will be reduced access to support. Economic instability limits youth access to education, healthcare, and psychosocial support, further worsening cycles of distress and harmful behavior. I can imagine when I was in campus, when I had just realized that I was experiencing, or I was going through depression. I was barely able to afford to go for therapy, and then therapy used to be, I think, around $10. Right now, therapy should be like $30, and then I wasn't even able to go for therapy, leave alone even get access to medicine or to antidepressants. So I can imagine right now the economy has gone, the state of economy is even much more worse. Things are more expensive, and you can imagine to someone who is even unemployed, they cannot even get access to these sorts of treatment, to mental health care treatment, and even access to healthcare, where Kenya is an example. It has been so hard. I mean, healthcare, just basic healthcare is actually a privilege. And if getting access to like physical healthcare is that hard, can you imagine how hard it is to get access to mental health care as well? So this is more likely to make people prone to getting used to riskier coping mechanism, now just like substance abuse. Thank you.
Thanks so much, Connie, for sharing. Oh my God. I think this conversation keeps getting interesting and more things coming up. I think some of the things that have come up from what you've shared, Connie, is that unemployment, which I think could also look like underemployment for young people, is a great contributor to lack of access, because there are various levels of care that are required for someone who is battling substance use disorders, especially on different spectrum, depending on what maybe they're battling with. Others are on weed or marijuana, others are battling alcohol, depending on all those drugs that are available or that are being consumed. And sometimes the substances being abused are actual medical and pharmacological, medication that somehow end up being used for wrong reason or in the wrong way, and somehow become addictive. Now, the levels of care will look like medical, or rather medical care, biomedical care. Other people will require psychological care. Others will benefit from alternate therapies. And all these are quite expensive. I think you mentioned that at the time when you were seeking care, it was around $10 per session. And you know that a session goes for around 1 hour. Right now, we're speaking around $30. And if we were being honest with ourselves, how or where would someone who is really unemployed and not having a stable income flow get the funds to sustain their care? Yeah. And maybe this is food for thought, also in the interest of time. I will now go to Natasha. Natasha, if you could speak directly to a 14-year-old today, someone who is struggling with depression or addiction in Northern Africa, somewhere in a village or a city, just somewhere within Northern Africa, what would you say to them that you wish someone had told you? Over to you, Natasha.
Okay, for me, considering that I was once in that place, I would first of all tell the person that you are not alone. Yeah, that you are not alone, because many of them feel like they are just hallucinating, or they are making up things in their head. So the first thing I would say is you are not alone. And I would say that what you feel right now might seem unbearable, but it will not last forever. I'll tell them that they deserve help, not shame. They deserve compassion, not rejection. And I would tell them to please don't not believe the lie that they have to handle all what they are going through on their own simply because there are people around them that don't understand or there's an environment that is not conducive for them. I will tell them to reach out to a trusted friend, an adult, a teacher, or even someone online, maybe a counselor or a psychotherapist. Let them know that their life matters, and even if the people around don't fully understand what they're going through, there are others who that necessarily do, like Jennifer was saying, and even Constance. Because I really wish someone had told me that I really didn't have to hide my pain and that it was okay to cry and ask for help. I would actually let them know that it's okay not to be okay. That's life. Those are it's part of our experience as people as humans who live on earth because there's always time for pain, there's always time for joy, there's always time for celebration, but there's always time to cry. I will let them know that they have to hold on, to keep hoping, and to believe that their story isn't over yet and they are not broken.
Oh my God, that is such a powerful message, Natasha. Thank you so much for sharing that message with us and with the world. Um, to anyone else who is out there and battling substance use, struggling with depression, and maybe struggling to come out of it, you're not alone, and it's okay to get help. It's okay to ask for that help. And now, in the interest of time, I'll go back to all the speakers. Thank you so much for being here. But I'll go back to all the speakers in 1 minute. Maybe just give us some closing remarks. Natasha, you want to go first?
For a closing remark, well, if I can talk about what was done here and what I had to talk about, I would say that this was really a powerful tool, and somehow it made me go back in time to when I was in depression and when I went through trauma, and it really makes me like I feel like it has stirred up the passion for mental health, and I feel more like reaching out. Like I need to reach out because there are definitely young people or younger people than me who need help and who are really being misunderstood. And sometimes they just need someone who has gone through the same thing to let them know that you're not making this up in your mind. I understand what you've been through because I've been there myself. So I'm really grateful for this podcast, and I know that there is a little stir up that he has done in me, and I'm so grateful. I'm honestly excited for what's coming next. Thank you.
Thank you so much, Natasha, for sharing that with us. And that's such a powerful story you've shared with us. And we are happy that you're doing much better now. And maybe this, as you've said, this is your cue to remember to save the people you can save around you by sharing the message, and of which I'm sure someone will listen to this podcast and they will be, something will change within them. Constance, please go ahead and give your closing remarks.
This was a really enlightening podcast where I have learned so much both from Jennifer and Natasha. I'd like to quote something that Edwin normally says, the communications officer here at GMHPN. I think though it's attached on the logo, he normally says or quotes unapologetically expert by experience. And I think this is something that I am going to encompass to myself so much this year, that we are going to be loud about our experiences as persons with lived experiences. We are more than just diagnosis, and we are going to be sitting at those tables with researchers and policymakers, and we are going to make sure that our voices are heard. Above all, to that one person who has just found out about their mental health care or their mental health experience or an illness or a disorder, it's scary at first. But with time, when you're going to get a voice, you're going to be able to advocate for others, not just for others, but also for yourself. I've also made it a goal for myself this year. While I am getting a voice for many other people, I'm also going to get it I'm also going to get it for myself, so that I'm not always going to be held by stigma, because we talk so much about the societal stigma, but nobody emphasizes on how individual stigma is so scary. But we are going to talk about our experiences with no shame, and we are going to be unapologetic about it, because we are the only ones who can change about how people view mental health cares. We are going to come up with better interventions. We are going to make the world better, even for other people who are going through the same experiences. And above all, we are going to be much kinder to ourselves. And we will always remember all those people that gave us a seat at the table when we did not even have a voice for our own, like GMHPN, and most importantly, like Sandra. Thank you.
Thank you for sharing, Constance. That's very powerful. Thank you for sharing. Jennifer, please go ahead and give your closing remarks.
Thank you, Grace, for moderating this, discussion very beautifully. When I first accessed treatment, one of the things that for months I fought with my psychiatrist about was, why is this happening to me? Or when they talk about, this may have been as a result of trauma. I'm like, yeah, but other people have had more traumatic experiences, and things like that. And so whoever is listening to me, whether you have, access care, whether you have spoken to a friend, a family member, or a professional, or not, whether you have done that or not, please do not dismiss your feelings. Do not dismiss your experiences. That someone else went through something that you think is worse than what you have gone through, it doesn't make what you went through less grievous, because it was grievous enough to have affected you in some way. So take it seriously. And yeah, just take it seriously. And like I said earlier, do whatever it takes to put your well-being first. You first. You first. Not what people think, not what society says, not you first. You first. And to people who care or who have people, dealing with varying degrees of mental health, conditions, please, I will plead and advocate that you be kind. The truth is, you may never understand what this person is going through. Even the person is trying to understand what he or she is going through. So the least you can do is just be kind and be present. Be there the way they want you to be there. But don't try to diagnose, don't be their second doctor, or no, just be there as a shoulder. Let them know that they can trust you through this journey. So those will be my final words to whoever may be suffering from any type of mental health issue, and then whoever has someone in their life that they care about that is going through any form of mental illness. Thank you.
Thank you so much, team. This was such a powerful session. And it's been an honor hosting you all today. Thank you for your insights, and I'm so proud of the work everyone is doing here. Natasha, Constance, Jennifer, and Sandra. Everyone is doing in their country, in their space, to promote mental well-being. My closing remarks will be, sit back and reflect, and whatever it is that is hurting you, whether you're dealing with depression, whether you're struggling with addiction, whatever it is that you're struggling with, number one, that this is a situation that is actually happening and you need help. Acceptance is really key, because that way then you're able to receive care, you're able to receive love, you're able to even ask for it. And it's okay for you to ask for help. Also, don't let yourself sulk. Feel your emotions, allow yourself to feel the things that you're feeling, allow yourself to walk through your emotions. Ask for help if you feel like maybe it's getting to a point where you're feeling suicidal, or it's really bad and you just feel like you need that help, and it's okay to ask for help. All in all, thank you so much for being here. It's been an honor having you around. Thank you. Over to you.